Local 12 News investigation is getting results. We first told you about the insurance payment crisis facing home health aides in our area last week. Many haven't been paid in weeks. Agencies, nursing homes, and suppliers are also waiting for checks in the mail. Since our series of reports, one insurance company is speeding up the payment process, but the crisis is far from over. As Local 12's Jeff Hirsh reports, it's become a real family affair for some providers.
I had a diving accident in 1993. It left me paralyzed from the chest down.
Like so many other permanently disabled people, Tim Hymer has a home health care aide who helps him with just about everything possible, like trying to keep his legs limber.
I usually do a little bit of massage.
And like so many other aides across Ohio, Tim's aide, Jan Reid, is owed lots of money by an insurance company for taking care of Tim. Some other aides around the state are quitting, though, getting other jobs, but not Jan.
I can't quit, no. I'll never quit.
That's because Jan is Tim's mother. The state of Ohio Medicaid program lets family members become independent paid providers for disabled relatives. Tim's brother Randy is one of his providers, too. But before you say, hey, shouldn't family members do this for free? Well, if they had to work somewhere else, Tim would have to go to a nursing home.
It allows him to be with people who care for him and will give him really good care, rather than having to be in a home somewhere with people that he doesn't know.
I mean, I have the people who care about me most, doing this, so I'm getting the best care possible by family members.
But just like providers who are not relatives, Tim's mom and brother are caught in the state of Ohio's change from state payment for home health care services to insurance company payment. Since June 1st, Jan says she has received only 2 paychecks, and Tim's brother just one from the Molina Insurance Company.
It's really frustrating because both of them, this is their income, and especially my brother, this is his sole income. And now late fees are piling up, overdraft charges, because it's been 2 months, and he's only received 1 week's pay.
The transition was just really bad. The system was not ready to be placed into production.
At least Tim's mom and brother have gotten some payments, but Tim also has an independent home care nurse, not a member of the family. And Jan says that nurse has not been paid anything since June 1st.
She's got a couple kids in college, she's got bills to pay, and she's ready to, I think as a matter of fact, she's doing some orientation tomorrow for a new job. She can't afford to go all this time without being paid.
Now, here's an irony. Even though many providers are not being paid, they cannot file for unemployment insurance because they're not unemployed. They're still on the payroll, even though they're not getting a paycheck. However, we are finally hearing of some people getting either full or partial payments, so perhaps the worst is over. Though I got to tell you, I have a pile of calls and complaints, so maybe it's getting over, but there's a lot of people still out there saying they're not getting paid. Back to you.
All right, Jeff, thank you. There are 2 insurance companies that are part of this program in Southwest Ohio, Molina and Aetna. In a statement this afternoon, Aetna spokesperson Rohan Hutchings said, quote, "We are sorry that this situation has caused delayed payments to some healthcare workers. We have been working with healthcare agencies and providers to get payments out as quickly as possible." Hutchings added that the company has sped up the processing of payments and is letting providers know when their money should be coming. He said the program has been running for only 60 days, and they look forward to delivering quality care for Ohio.